Okay, this is a new video. It's May 31st, 2026, and I'm going to add a few things. I previously made advice for surgeons. This one is going to include new information like about sunlight. Sunlight has more than half of its wavelength spectrum in red light and infrared light, which increases mitochondrial function. It fluidizes the water in the matrix of the mitochondria so ATP synthase can spin faster. They've shown that patients that are on the sunny side of the hospital in the ICU, for example, they go home, like 25% earlier. So they also used to put patients outside back in the old days with the TB sanatoriums and whatnot. And so, they're not going to let you, they're not going to build a sun deck for your patients overnight, and you can't put them in a room with a window and the sun shining. But what you could do is get an incandescent light bulb, because those have about the same electromagnetic spectrum as the sun, and they have a lot more red and infrared, which will help the mitochondria in the patient to function more efficiently and give them a better chance to heal faster. Okay. The other thing too is ICUs should be more careful about letting patients sleep, because a lot of healing happens during sleep. Melatonin improves mitochondrial function. It also increases ATP production in mitochondria. It's produced by the pineal gland at night, goes into the blood, goes to all the cells. In the daytime, the mitochondria themselves produce melatonin, but at night it comes from the pineal gland. So anyways, you shouldn't wake them up unnecessarily. You shouldn't be poking and prodding them in the middle of the night unnecessarily. I know you need to monitor them, but helping them to sleep well will help them to heal better. Most people tend to prefer sleeping on their side. Of course, we move around at night, but sometimes they got so many apparatus attached to them they can't sleep on their side. So if you can enable them to sleep on their side, that can help. Everything heals better with good blood flow, so you want better wound healing, fewer infections. You'll decrease the risk post-op, MI, etc., and get them off the vent sooner. So you don't want to have any caffeine. You don't want to excessively stress them out, and you want them to sleep. High-fat diets are bad. They need more protein than usual to help heal the wound. So increased protein is legitimate concern in the early post-operative phase. But you want the fat intake relatively low, because fat causes the red blood cells to stick together. All the red blood cells have a zeta potential, a negative charge on their outer surface. Same with the white blood cells, same with the endothelial glycocalyx. It's been said, I say it, understanding the zeta potential is the beginning of wisdom in terms of understanding blood flow. And surgeons are really deficient in their training because they don't know this. I never in my whole life met a conventional MD, DO trained surgeon who knows what I'm about to tell you. You can watch the video at Dr. McDougall's YouTube channel. It's called High Fat Meal Blood Sludge, and you'll see the high-fat meal, the chylomicrons, increased triglycerides, increased LDL cholesterol. So initially it's chylomicrons. They stick the red blood cells together, creating blood sludge, or rouleau formation, French stack of coins. And that decreases tissue oxygenation. Different numbers have been measured. Peter Quo around 1960 measured 15 to 20%. Roy Swank, MD, PhD, Harvard guy who works with MS patients, he measured in a hamster brain 35% drop in oxygen delivered to the tissues from high-fat meal and blood sludge. Confounding variable is you can also get a drop in oxygen tissue delivery due to excessive dietary sodium, which is a vasoconstrictor and inhibits endothelial nitric oxide synthase, so you don't get that nitric oxide vasodilator. Okay, eating greens, you get the oral pathway for production of nitric oxide, which can also help vasodilate, get more blood flow to the tissues. You don't want to be eating high fructose corn syrup, because high fructose corn syrup, the way it's metabolized in the liver, it yields some increased amounts of uric acid into the blood that have an inhibitory effect as well on endothelial nitric oxide synthase. So you don't want that, causing insulin resistance and problems as well in the post-operative phase. Let's see. Potassium and magnesium are vasodilators in a sense. They come from eating whole plant foods. So the patient should be getting some whole plant foods to the extent that's possible in the post-operative phase. You guys might also want to watch my video on abdominal pressure syndrome. That'll be, in a separate video. I made plenty of those, like about Dennis Burkitt and whatnot. So anyways, I hope you found that helpful.